Hey there everyone. I am very energetic today. In the previous video we had studied about the anterior tibial artery course, beginning course, termination, relations, branches with the help of the diagram, explain everything. So in this video we're going to study about the deep peroneal nerve, and we are done with the front of leg chapter completely okay in only a small duration, right? Not hours together, but a very small amount of time. So the deep peroneal nerve, okay, I'll use the yellow color because nerve is yellow. So it is a nerve of anterior compartment. Of course, I've discussed in the first video of this chapter. Please go check that out. I'll link that out in the description box. Of the leg, okay, anterior compartment of the leg and the dorsum of the foot. Okay, the dorsum of the foot. So the deep peroneal nerve, it is a nerve of the anterior compartment and the dorsum of the foot, and it is a branch of the common peroneal nerve. Okay, we'll see here the plexus again. See, I am drawing plexus in every single video of mine to explain everything easily. So see, we have L4, L5, S1, S2, S3. On the posterior we have the common peroneal nerve. How to remember posterior or dorsal? See, peroneal has P, so posterior also has P, so it can be also called as dorsal also. Okay, the dorsal. So we have the peroneal nerve L4. Oh my pen. Okay, the L4, 5, S1 and S2. Okay, so this is it, and this is the tibial nerve, same root, extra is S3. On the anterior side we have the tibial nerve. So see, this one gives off two branches. The common peroneal nerve gives off two branches. This is the superficial peroneal nerve, and this one is the deep peroneal nerve. Okay, the deep peroneal nerve. So this is the deep peroneal nerve. We saw the origin, and with the root values we've seen the origin, and okay, it begins on the lateral side of the neck of the fibula. Okay, lateral side bone, of course it is fibula, so don't need to put so much pressure onto this. It is not rocket science, right? Lateral side, common sense, we have the fibula. So it begins on the lateral side of the neck of the fibula, enters the anterior compartment. Okay, enters the anterior compartment. It's fine. By piercing which septum? The intermuscular septum. Okay, where I'll give a short explanation on this. So this is tibia and this is fibula. This is the anterior compartment. Okay, so this is the lateral compartment and this is the posterior compartment. So here we have the intermuscular septum. Let me change the color. This is the intermuscular septum, so it is piercing it and coming. Okay, it's piercing it and okay, it is coming like this, piercing it and coming to the anterior side. Okay, to the anterior side. So extensor digitorum longus also it pierces and goes to the dorsum of the foot and divides into the lateral terminal branch and the medial terminal branch. Towards the lateral, towards the medial. Okay, it is in the name itself. Lateral side we have the extensor digitorum brevis short. Okay, and the tarsal joint. To the medial, towards the medial we have the skin, first interdigital cleft. Okay, suppose this is your big toe and this is your this is your big toe and this is your second toe. So this is the cleft. Okay, so it supplies the skin of this region and the proximal joint of the big toe. Okay, the medial one, because this is very common. Okay, we know that it is on the medial side. The grade 2 is on the medial side. So this is the medial. The lateral we have the tarsal joint and the extensor digitorum brevis. So now we're going to see the branches of the deep peroneal nerve. So it is a branch of the common peroneal nerve, root value L4, 5, S1, S2. Okay, lumbosacral plexus, please check out the video. I'll link it in the description box. I have explained the lumbosacral plexus only in 5 minutes. Okay, so the common peroneal nerve gives off branches. The deep peroneal nerve, nerve, and the superficial peroneal nerve. So the deep, we are concerned about the deep one because we are studying the front of leg. It is supplied by the deep peroneal nerve. Okay. So see, it gives off a few branches. We have the muscular branches, articulating branches, and cutaneous branches. Muscular branches, they supply to the muscles like the tibialis anterior, it should be Okay, this is tibialis anterior, extensor digitorum longus, extensor hallucis longus, peroneus tertius, and extensor digitorum brevis. So this gives off muscular branches, the deep peroneal nerve, it gives off muscular branches to the muscles. The muscles we have already studied in the beginning of the chapter, that is the tibialis anterior, extensor digitorum longus, extensor hallucis longus, peroneus tertius, and the extensor digitorum brevis. Okay, so these this is supplied by this one, and this is a lateral branch of the deep peroneal nerve. Okay, lateral branch of the deep peroneal nerve. We have already studied. Please check out the video. I'll link it in the description. So cutaneous branches, as the name suggests, superficially, so it is coming downward and supplying the first toe, the great toe or the big toe, the second toe after the great toe, it is supplying two, and the articular branches of course supply the joints. Okay, so they're supplying the ankle joint, the tarsal joint, the tarsalo metatarsal joint, and the metatarsalo-phalangeal joint. Okay, which joints? Ankle joint, tarsal joint, tarsalo metatarsal joint, and metatarsalo-phalangeal joints. Okay, so these are the articulating branches. So it has three branches: muscular branches, cutaneous branches, and articulating branches. Muscular branches to 5 muscles, and cutaneous branches to first and second toe, and the articulating branches to the ankle joint, tarsal joint, tarsalo metatarsal joint, and metatarsalo-phalangeal joint. Okay, so this is the origin, course, beginning, termination, diagram, and everything of the common peroneal nerve with the plexus. Thank you so much. Please subscribe.